Welcome to this AJR Insider video. I'm Andy Rosenkrantz, Editor-in-Chief of AJR. I'm here today with Dr. Heather Jacene, Associate Professor of Radiology at Harvard Medical School, who is editor of our Nuclear Medicine section. In this video, she'll be sharing with us her insights about the area. Heather, thanks for joining us.
Thank you, Andy. I'm really delighted to be here this morning.
Can you tell us about your background in nuclear medicine?
Certainly, I've been a nuclear medicine physician for almost 20 years. I did my residency and fellowship in nuclear medicine and PET-CT at Johns Hopkins. I was on the faculty for 5 years there before moving up to Boston. I am in the trenches every day, reading general nuclear medicine and PET-CT studies. I also lead a very busy clinical and research theranostic practice. As a part of my work, I've also done clinical research throughout my career. The work has primarily focused on molecular imaging to characterize the biology of tumors and tumor response to optimize treatment strategies for patients with cancer. What I really enjoy most is bringing together the multidisciplinary teams of imagers and clinicians to practically integrate these molecular imaging techniques into clinical practice and research trials.
What trends have you observed for recent AJR submissions in nuclear medicine?
Nuclear medicine, molecular imaging, and therapy has really been enjoying a renaissance over the past several years. And this is across all the disease specialties, neurology, oncology, and cardiovascular. As a result, I think that the primary trend we've been seeing are studies investigating novel radio tracers, descriptions of their pros and also their pitfalls as we gain more experience with each. We've also seen newer generation nuclear medicine and PET-CT scanners, and we are seeing an increase in explorations of how changes in acquisition protocols can really impact image quality and interpretation.
And with that in mind, what do you see as areas of priority for us for publishing in nukes over the coming year?
I think that the clinical applications of these novel radiopharmaceuticals are going to continue to come in. We will see studies addressing really how we can best implement these into routine practice. Where can we actually show the clinical impact? As I said previously, the technology in nuclear medicine has been evolving over the recent years, particularly scanner hardware and configurations, reconstruction algorithms. Some of these are incorporating AI. I think all of those have a lot of potential to decrease imaging time or reduce radioactivity that's needed for high quality imagings. So studies both exploring and validating how these features can be exploited to balance operational efficiency and diagnostic quality as well as accuracy are of great interest. Another area that also stems from having a better hardware and software are quantification studies of tracer uptake across the various indications for diagnosis, but also longitudinal follow-up. And again, I think that's true for oncology, but also, for example, neurosciences with the approval of treatment agents for Alzheimer's dementia. How do we use these novel agents like like amyloid imaging to help the clinicians make their decisions? And then lastly, a huge topic in nuclear medicine right now, and I think one that is challenging moving from big academic centers into the community are implementation of theranostic procedures and operations, including issues such as dosimetry. So can we use these technical advances that I just also spoke about to move what we often consider very burdensome and left to academics into routine clinical use? So I think we're very interested in how people are doing that, both in academics and out in the community practice.
That's quite the range of areas. What tips do you have for authors looking to publish in this section?
Sure. I think that the first and most important thing is having a strong hypothesis and an objective that really addresses a clinical gap and the clinical gap that can impact the general radiologist practice. I think that it's okay if the work at the time of the submission of the publication is primarily still used in academic centers, but something that is close to being available out in the community to general practitioners. It's important to clearly define patient population and methods such that the work can be reproduced. In nuclear medicine, sometimes patient populations may overlap, and to be really clear about which population a particular question is being addressed. I would always, and I've had to do this numerous times and take me a while to learn, but engage the expertise of a statistician as soon as possible at the time of study design, even if it's a retrospective study. They can really help you craft objectives. They can help you design your spreadsheet, making sure that the data collected is what you want to address your objectives. Then all the results should have clear methods and address the objective. You really kind of want to tell a story through your manuscript. And then, of course, the discussion should put the results into the larger context, not just repeat the results section. I think it's also important that the conclusions are not overstated, but also not understated, but really reflect what the results show. It's okay if you have negative results, because it's important to know that somebody studied something and maybe we thought it would be useful, but it's not. But I think those studies can also help improve our practice. And oftentimes we may feel like we can't send them in for publication because they're not going to have as much impact. But I think those can be equally impactful as well.
Yeah, those are really great points, including the one about the potential importance of negative studies as well. Are there any particular common pitfalls that you're seeing in submissions?
I think the main ones that we've really seen is sometimes there's a lack of a clear objective or what the authors are trying to get at in that publication. Often because nuclear medicine sometimes is a little bit of a niche within radiology, we see early phase studies that are not yet ready for clinical implementation, or they're not going to be ready for 5 or 6 years rather than several months. These are often hard to grab the interest of a more general AJR readership. Again, I also think that really sometimes we've seen it's difficult to figure out what the study design is. If it's a prospective study, but done in it's prospective data, but then it's a retrospective review, and the population are not clearly defined. And then also sometimes methods are difficult to reproduce, or there's a lack of inter-reader study for those retrospective studies. I think those are the most common ones that I've seen in the recent submissions.
Anything else that you'd like for our listeners to know?
Yeah, any type of publication, whether it's research, education, a review article, an AJR review box, these all take a lot of time and substantial effort. And we really appreciate that the authors are taking the time and submitting their work to help the greater community. We take a lot of care in the review process. And my goal is really to ensure that the journal and the authors are putting out high quality evidence that positively impacts how we work and impact our patients. So I hope that whether the outcomes are for authors, positive or even not what you were hoping for, that any feedback that is given is taken as constructive and can be used to improve work in the future. It's all a learning process at every stage, I think, in somebody's career. And publishing is one of those skills that you develop over time. And I really enjoy reading everything that comes in. So keep the submissions coming.
Heather, thanks again for joining us.
It's been a pleasure. Thanks for having me.